Good morning. I hope that you're doing super well. I am quite excited about today's topic because when it comes to babies and essential oil, it's really important to know exactly what we're using and how we're using it as well. So in today's video, we're going to be chatting through which essential oils are great to diffuse as soon as your child starts with those first signs of a cough or a little cold. Now, I've got two small girls, and I know how stressful it can be when your child is sick, when they, that first cough that you wake up and you hear it during the night. It literally sends shivers down me. I'm awake from then. Thoughts of how bad is this going to be? How many nights am I going to lose sleep trying to get through this? How long will it last? Do I just, wake up and make a doctor's appointment now? Do I wait it out? Where do I go to from there? And probably, I know before we had essential oils, 3 nights into that fever, the cough, stuffy noses, you eventually make that doctor's appointment. You're dishing out antibiotics left, right, and center, probiotics, all while you're pretty sleep deprived as it is. I don't know if anybody can relate, but I remember those days when before I had essential oils in our lives, just what that looked like, the confusion, putting something inside your baby that you're not really so keen to do. The good news is we found a new way, and you can find a new way as well. You can do things a bit differently. So obviously if your baby is still very small and they're starting to struggle to breathe, I wouldn't wait it out. I would get to the doctor immediately. That's what I would do. When children are little, their immune systems are not strong enough to handle things yet. So I would just, have your GP check them out. But if they're a little bit older, symptoms are still mild, there are a number of oils that you can make use of to try to treat the fevers, the infections, the stuffy noses. And we're going to have some videos coming up on those topics specifically. So just take a look out for those. We're not going to cover that here today. We're going to cover what oils we can use inside the diffuser to help with those symptoms. Obviously, using essential oils on the body is a whole different topic. We're just going to focus on the diffuser today. Okay, so you've got your diffuser and your baby has started with that, that mild fever, that little cough that's starting to niggle, it's just not sounding so nice. What do you do? Okay, so you're going to grab your diffuser. I'm using today the doTERRA Petal diffuser. I love this. It's got 150 milliliter capacity, so it's quite a big capacity, quite a lot of water, which means you can use a lot of oils and you can use it over and over again. It's not going to, you don't have to top up every morning or every 3 hours. It also has a great run time. So it's got the 2 hour, 6 hour, but then it's got a 12-hour intermittent run time of 5 minutes on, 5 minutes off. So I love having these around the house. When it comes to little ones though, for a baby specifically, you actually only want to be diffusing for 1 hour every 3 hours. So what I would do is I would fill this up, set it on to the 2 hour setting, and set an alarm for myself to remind me to turn it off. Okay, so it's only running for an hour, allow the next 2 hours to pass, and then pop it back on again for 1 more hour. Obviously, when it gets to the night time, you don't want to be setting alarms for yourself every hour and diffuse it on and off, because that just makes life tricky, and we're trying to avoid that. So what I would do in the nighttime, we use less oils, and we're going to chat about it in a second, on the 12-hour 5 minutes on, 5 minutes off. Okay, and we're going to let that run through the night. Important that the door is kept open for ventilation, and we are going to use less oils than we would in the day. Okay, so which oils are we using? Hands down, my favorite with anything kid related or baby related is lavender. Okay, it's just got so many benefits. It has the ability to manage pain as well as joint or muscle pain that's associated with a fever. So studies have actually shown that diffusing with lavender in spaces where there's pain just reduces people's mental load on their pain. They actually don't experience the pain to the degree of which they were before. So lavender is incredible for healing. It's also got anti-inflammatory properties. So also what the studies have shown is that actually the bacteria in the spaces where lavender is diffused is less than those spaces where it's not diffused. So a great one to be diffusing at any time, especially when someone is sick. Okay, the next one that I love is frankincense. It is such a beautiful powerhouse oil. It has a variety of benefits that just extend beyond our mind's capabilities. Okay, when it comes to colds or flus, it has the ability to break up any congestion. It promotes upper respiratory health. It's helpful in reducing inflammation. So it also helps to increase the secretion in the airways. And that's what our over-the-counter medications aim to do when they're treating coughs. So that is what frankincense is able to do as well. Really, really awesome. I would never be without this one in our home. You don't need a lot of it, so a bottle of it lasts a really long time. You're not going to use a bottle up in 2 months. It's going to be a while. That bottle's going to sit on the shelf for a long time. You're going to be using 1 or 2 drops at a time. Next one that I love having is lemon. Lemon is also safe for babies, and it's a great option because it's antiviral, antifungal, and it's just an all-round cleansing oil. So it's helpful in combating and fighting off bacteria. It's also able to relieve any throat infections. Okay, so it helps to clear the nasal passages, just making it easier to breathe for your baby. Okay, it's also very helpful in supporting a fever. So it's a great one to add on if there is that fever present as well. Okay, and then a very big one, and the last one that we're going to look at is cypress. Cypress you can only use on babies older than 6 months. So don't go using this on a very small, or diffusing this around a very small baby. It's a very strong, potent oil, but it's also got a very long list of benefits. So a great one to have in your home. It's just really one of the best oils when it comes to babies' coughs. It helps to calm the respiratory system, and it's even able to treat more severe respiratory conditions such as asthma, etc. So a really good one to have around for whenever it's needed. We must remember that we don't want to just be using our oils for no reason. We want to have them available when we need them. Okay, so just a quick recap. Lavender, frankincense, lemon, cypress. If you're using it in the lounge with your baby, a large ventilated room, I would use about 5 to 7 drops. You can kind of just mix them up as you like. And then you're allowed to run for 1 hour every 3 hours. When baby goes to bed, you're going to use an intermittent setting of 5 minutes on and off. But then I would only use 3 or 4 drops in a large capacity tank that can run for 12 hours. So it's a really slow, continual release. I hope that is helpful for you. Please let me know how it goes if your baby does end up getting a cough and you are able to use these oils. Otherwise, what other oils are you using in your home to help your family? Remember to subscribe because we do have some other videos coming out in this series for babies and essential oils. And then grab your free essential oil and baby safety guide below in the comments. You can download that. And that's just looking at general dilution strategies for diffusing and rollers and just safety guidelines when you're using essential oils with your little ones. Thanks so much for watching. I will see you soon.